Hello, everyone. Good day, good evening, good afternoon from wherever you are joining us today. Thank you for joining the Foundation for Peripheral Neuropathy's first ever summer education series. We're grateful to have your time and attention for the next hour as we dive into today's session. Here at FPN, we're dedicated to improving the lives of those affected by peripheral neuropathy through awareness, education, advocacy, and research to advance the discovery of new therapies and one day cures. Your participation today helps demystify what it means to have neuropathic pain and helps make our patient community more aware of and engaged with their diagnosis. My name is April Hubert, and I am proud to serve as webinar moderator and director of development here at the Foundation. I'm honored to represent the premier resource for information, research, and advocacy surrounding the individual and collective experience with PN. Thanks again for tuning into our summer web series, session number 5. Before we begin today, I have 3 reminders for you. 1, yes, this session is being recorded. It will be emailed to you after the program and posted on our website in the coming days. The slide deck will also be available. 2, for those participating in the live session today, we will have a question and answer session towards the end of our time together. Please use the questions box to submit your question, and we will try to get to as many as possible. Please submit questions about today's topic and refrain from sharing personal medical information. And number 3, if you're having audio issues, you probably can't hear me right now, but you can dial in by phone using the instructions sent to your email. Remember, this session is being recorded and you can always view it at a later date. Now, I'm pleased to introduce our guest speakers for today. Shauna Patterson is an associate professor in the Department of Neurology at Mount Sinai in New York City. She's honored to continue her work as the patient education advisor for the Foundation for Peripheral Neuropathy. Dr. Patterson completed her neurology residency and fellowship in clinical neurophysiology at the Columbia University College of Physicians and Surgeons in New York. In 2022, Dr. Patterson completed her Master's of Healthcare Delivery Leadership at the ECAM School of Medicine at Mount Sinai. Dr. Patterson is also involved in a variety of clinical, quality improvement, and medical administrative initiatives, and her publications include manuscripts and text chapters on many, many topics, including neurological complications of COVID-19, disorders of the peripheral nerve system in intensive care patient, myasthenia gravis, and neurological complications of celiac disease. Also joining us today is Dr. Lisa Osowski, a registered licensed dietitian with a master's degree in nutrition from the University of Illinois, Urbana. She completed her dietetic internship at Hines VA Hospital in Chicago. And with over 25 years of experience as an RD, Lisa has worked in many settings, including hospitals, outpatient clinics, nursing homes, health clubs, and wellness organizations, educating and empowering thousands of people to adopt nourishing diets to support healthy living. Currently, a clinical dietitian and advocate Good Shepherd in Barrington, Lisa became board certified in oncology in 2017 and is currently pursuing a diabetes education specialist certification. Mother of 2, her hobbies include reading, walking, lifting weights, and cooking. Please give a warm welcome to our guests today. Shauna and Lisa, the virtual floor is now yours.
April, hi, thank you so much. Can you hear me?
Yes.
Great, perfect, okay, great. Thank you so much. It is such a pleasure to be here again. And thank you everyone for joining. Hopefully we'll be able to touch on some pearls that you'll be able to take away. And the theme of the evening is really living well with peripheral neuropathy and looking at that in a different number of ways. So to get started, I wanted to think about daily life, day in, day out. How do we look at different aspects of how neuropathy may impact or cross over into our daily life? And how do we respond to that in a way that can help improve our personal situation? Everybody's different, so I'm trying to cover a variety of different topics so that hopefully we'll be able to touch on things that may apply to you. Briefly also, I wanted to just kind of level things here in terms of what we're talking about when we say peripheral neuropathy. It's really a large umbrella term that refers to a variety of different types of conditions that are all referred to as neuropathy, but these can really involve weakness, sensory abnormalities, pain, numbness, and they all involve the peripheral nerves, the nerves that are really outside of the brain and the spinal cord. These are the nerves that are involved in moving muscles, involved in sensation, and also involved in controlling some of our internal organ function, including blood pressure, heart rate, sweating, and gastrointestinal function, and others. Neuropathy is, as we might imagine, one of the most prevalent neurological conditions encountered by physicians of all specialties. And we tend to see higher rates of neuropathy in the older population relative to earlier in life, as neuropathy is acquired through a variety of different mechanisms. And again, just to think about some of the symptoms that we'll be discussing in terms of how to try to optimize them. When we talk about motor weakness, this is dysfunction with some of the nerves that help control movement or help control our muscles. And symptoms might include weakness and even imbalance. Sensory symptoms may include numbness or lack of sensation, sometimes feeling sensations that weren't normally there, like burning or tingling, and also sometimes challenges with balance, because in fact, the ability to really feel the ground underneath our feet in a very fine-tuned way is really an integral part of our ability to have good balance when we're standing or walking. And as mentioned, also neuropathy can impact, although it does not always impact, the autonomic nervous system, which is also part of the peripheral nervous system. And these, again, are nerves that help control our cardiac function, blood pressure, our gastrointestinal system, urinary system, and also sweating. And so imbalances from neuropathy that impact these areas can also sometimes interfere with our daily life through resulting symptoms, including dizziness, nausea, diarrhea, problems with urination, and problems with sweating. So first I wanted to speak about maybe what is one of the most common symptoms that patients mention when they're struggling with neuropathy, which is managing pain and discomfort. Maybe your neuropathy has an obvious other form of treatment, maybe it doesn't, but managing the symptoms is so important on a day in, day out basis. And for many patients, unfortunately, they may have pain or discomfort with the neuropathy. So first I wanted to start, before we mention other prescription medications, I wanted to start by kind of backing up and casting a broad net. There are actually a variety of supplements, which you may have heard about, which can help in the treatment of neuropathy symptoms. And actually, some of these have been shown to also help in preventing neuropathy. Alpha-lipoic acid has been studied actually for treatment specifically of diabetic neuropathy. It has anti-inflammatory effects and reduces oxidative stress on cells. And several studies have shown improvement in neuropathy symptoms with long-term use. And specifically in terms of the doses that were studied, 600 milligrams taken each day was found to provide an optimal benefit without increasing risks. One thing you might notice when we talk about a number of these studies is that they often are focusing on specific types of neuropathy. For example, diabetic neuropathy, which is also the most common type of peripheral neuropathy. And this is probably because neuropathy arises in different ways and may also be easier to compare and say this is a group of patients we know this is effective for, as opposed to combining in some of these studies patients where they have neuropathy from a variety of different causes. And diabetic neuropathy, again, being so common, is often one we tend to see included in studies. Acetyl L-carnitine is also shown in clinical trials to be effective for diabetic neuropathy. And for some patients with chronic neuropathy, they found that taking between 500 and 1,000 milligrams 3 times a day for some period of time, patients showed improvements in pain and also improvements in sensation. Studies of other types of neuropathy, again, neuropathy that is thought to be due to causes aside from diabetes, had more mixed results. And vitamin D, lastly, I think is interesting because it has been shown as a risk factor in some studies for diabetic neuropathy. There were some associative studies that showed that patients who had similar levels of diabetes, patients who also had vitamin D deficiency were more likely to develop peripheral neuropathy than those that did not have vitamin D deficiency. And in several trials, they showed improved neuropathy pain in patients with diabetic neuropathy where they took 50,000 international units of vitamin D a week. And again, the benefit at this point is less clear for patients with neuropathy and normal vitamin D levels, but it is important to check your vitamin D level and keep that in mind. I would be remiss not to mention B vitamins. They are so important in peripheral nerve function. Vitamin B1, which is also known as thiamine, has been shown in diabetic patients to be an important vitamin. And some of these patients may be more vulnerable to vitamin B1 deficiency. Independent of diabetic neuropathy patients, we know that in any individual, vitamin B1 deficiency itself can actually lead to peripheral neuropathy. And a study has shown that taking vitamin B1, 600 milligrams a day, can help improve pain in patients with diabetic neuropathy. Lastly, vitamin B12 is also an important vitamin for nerve function. And in cases where it is deficient, it can cause neuropathy. Fortunately, vitamin B12 deficiency is not uncommon in the United States, but particularly in older individuals where absorption may decline, and in certain other conditions where people may have had surgeries or have other autoimmune diseases where they can't absorb vitamins well. But interestingly, in one study of patients with diabetic neuropathy and normal vitamin B12 levels, taking vitamin B12, 500 milligrams 3 times a day, helped improve the symptoms of neuropathy after 4 months, which is kind of a long time. If you weren't sure if you were noticing any improvement, you have to, in this case, make sure that you continue taking the vitamin for several months. So it's something to bear in mind. There are, of course, I did not, for my end, hopefully this is larger for you, but I will read out the names at least here. These are somewhat small in terms of the font. There are a number of prescription medications which are used in neuropathic pain treatment. Some of these were actually designed for other indications related to different types of neurological or even psychiatric conditions, but fundamentally they all act on nerve cells and subsequently were studied to see if they may have a benefit in terms of nerve symptoms, and many of them were found to have a benefit. A couple examples are gabapentin and pregabalin. The brand name for that is Lyrica. These are both effective for peripheral neuropathy painful symptoms. There are other medications which were initially developed as antidepressants, which were subsequently found to be beneficial for treating pain related to neuropathy, including duloxetine, the brand name for which is Cymbalta, and amitriptyline, the brand name for which is Elavil. And there are a number of others, and I think in all of these cases, it is really important to look at the side effect profile, to look at what time of day your pain may be worse, if there is a time of day that it is worse, to take a look also at other medications you may be taking and making sure there's no interactions, and seeing if any of these might be a good fit for you if needed. And it's important, of course, to work in close partnership with your doctors. And there are always a number of medications that are being studied on an ongoing basis to see if they may be helpful as well. Finally, there are also topical agents which can be helpful. Some of these might be available over the counter, such as low percentage or low concentration lidocaine preparations, but there are lidocaine patches which can be helpful at a prescription strength level, and also capsaicin patches, which are oftentimes applied by a physician because they can have actually a pretty, if they get on your skin in areas that are not impacted, they can cause unpleasant burning sensations, but that's another option as well for some. And from the standpoint also of different kinds of agents, some patients will find that different creams or other over-the-counter preparations with menthol or other things may help them with their pain. And truthfully, unfortunately, we don't have any of these medications that will necessarily make your neuropathy symptoms completely eliminated and make your nerves or your affected foot or leg or hand feel completely normal again. However, here we're really focusing on reducing painful symptoms so that you can be comfortable and that you can live as full of a life as possible for every day. Also, there's something that we may call integrative therapies, which are different kinds of alternate therapies that some individuals use for treatments of neuropathy, and these are often of broad interest because sometimes people see them as maybe more natural or a more attractive alternate to certain types of prescription medications. So there have been surveys looking at what patients are trying. There's a variety of different things, and about a third, almost between a quarter and a third of patients surveyed in this particular study thought that their neuropathy improved when they were trying these different interventions. A few things just to mention in terms of caveats. Not all of these are proven as completely effective. We're not sure in all cases if the benefit is maybe some of a so-called placebo, which can be incredibly powerful and beneficial in some cases, but sometimes we don't have good scientific data to support the efficacy of some of these interventions. The other thing to mention is that occasionally in herbal remedies, the ingredients are not posted, and so we don't know exactly what patients are taking, and it's important to be careful that it doesn't include something that might be dangerous. So oftentimes my personal style is to partner with patients when they show an interest in this, have a real honest discussion about what they're interested in, making sure it's safe, and making sure certainly that it's also affordable for them, especially if it's something that is not proven, and most of these things are may not be covered also by insurance. Sleeping. Sleep is one of the most common challenges for patients with neuropathy, and for some reason it is not uncommon also, unfortunately, that neuropathy symptoms tend to feel worse in the evening when people are laying down trying to relax and go to sleep. And it isn't that neuropathy is worse at night and better during the day, but we do think that it may be that there's just less competing stimulation for the brain at that time of day. Your brain isn't distracted by as many different thoughts, perhaps, or other sensations from walking around or doing other things. And so a lot of the sensitivity kind of comes to the forefront, especially when there's pain, when you're trying to lay down and relax and kind of let everything go at the end of the day. But fortunately, we do have some instruments that we can use and implement for patients to help with this. First of all, as a quick kind of reference back to some of the medications I was mentioning, some of those medications actually are really great to use potentially at night. For example, gabapentin, for some patients, Elavil or amitriptyline, because some of these medications for many patients, not all, can have a side effect of making them feel a little bit sleepy. And so it can be almost using the side effect for that patient, if they do experience it, as an advantage where you're treating the pain and also giving them a medicine that may help facilitate relaxing and sleeping. But we certainly know that sleep deficiency adversely impacts pain, and pain makes it harder to sleep. So it's this vicious cycle. It's really important to pay attention to. And there have been studies that have looked at this, and also how underscoring that it's really important to work with patients on this in particular. There's certain things called sleep hygiene, which basically just means like dental hygiene, like what are you doing in general? What are your habits that can help put you in a position for managing painful neuropathy symptoms and helping you get a better night's sleep? And some of these are using any pain interventions in advance of bedtime. So if you're using something topical before bed, or you're taking a medication for pain, trying to help yourself have less pain as you're getting ready to go to sleep. Sometimes if people forget or they don't realize it's important to take it at a certain time and they take it right as they're about to go to bed, it can cause some challenges because it may take time to digest or get into your system or take effect. And for a pill that you're swallowing, that may be 1 to 2 hours, for example. So unfortunately, for some patients who are taking their pills right as they're going to bed, they may be laying in bed for that period of time feeling like, is this helping me? I don't feel like this is doing anything. So sometimes we talk about what time do you go to bed, and think about taking that last dose of medication or the bedtime dose of medication for pain 1 to 2 hours before you want to be feeling sleepy and going to sleep. And sometimes people have to kind of play around with that and try to remember that. Also, in general, sleep is optimized across the board if we have more consistent times when we're going to sleep and waking up. Timing, of course, of caffeine and alcohol consumption is important because drinking either of those too close to bedtime can actually impair your sleep quality. Exercise in the morning has been shown to help people feel more tired toward the end of the day and sleep better at night. For some people, exercising later in the day can be pretty stimulating and sometimes can make it hard to relax and go to sleep at night. Other features of the environment that can be beneficial for sleep include maintaining a cool temperature in the room where you're sleeping, a calm environment, and also avoiding screen time for at least an hour before going to bed, because the light from the screen can stimulate a certain part of your brain that can activate your brain into a more of a daytime mode, if you will, a different type of circadian rhythm. Some patients find that localized treatments also really help a lot and alleviate pain and can help them fall asleep. For some patients, having a foot rub or soaking their feet, sometimes wearing heavy socks or compression socks can help. And again, using certain topical ointments or medications can also be beneficial at this time. And I would also like to just mention kind of revisiting your living space and habits. So often, especially if we've lived in the same house for a long time, we may look around and not kind of take a step back and look at where you are right now with your neuropathy, with your symptoms, and are there certain things that could be kind of easily changed that would make your day-to-day life a lot easier? So some of these things might include, when you get up in the middle of the night, turning on the light before you go to the bathroom. It may be something that many of us are used to, kind of feeling our way, or we know the way in the dark. But truthfully, especially with neuropathy, you may have a lack of sensitivity on your feet, and you may not be able to easily anticipate when there's a bump in the carpet, for example, that you might trip over, or to be able to feel that little dip at the landing somewhere that, again, could be a fall risk or a tripping risk, which is horrible. If you are prone to dizziness, making sure that when you first are getting up, that you sit up and then pause and take a minute if you feel dizzy, and then stand up slowly and again pause until you no longer feel dizzy before continuing to walk. Obviously, working with your doctor if you're having regular dizziness is also important. If you're feeling unsteady in the shower, getting a handrail in the shower to hold on to, especially to help with stability when you're closing your eyes in the shower. For some patients who have trouble with manual dexterity, even making sure they get kind of a thicker or rubber grip to put on keys or pens if needed can help improve dexterity quite a bit. Many patients find that they have a lot of benefit if they play around with different types of shoes, and that wearing comfortable, supportive shoes with good traction can make a big difference in terms of their neuropathy symptoms. And the last thing that I want to mention, which certainly doesn't apply to everyone, but I've heard a number of stories and I think it's worth mentioning, is if you're at a point where someone has mentioned to you, whether it's a physical therapist or a provider, that look, you don't use a cane, but you might benefit from a cane, or you use a cane, but you might really benefit from a walker, it oftentimes feels really uncomfortable. People see it as a stigma. They obviously don't want to have to rely on this device, but I have certainly had a number of patients, when they get them, they say to me a lot of positive things come of it, and actually it adds to their freedom in many cases. So for example, some of the walkers have seats that fold down, and for some patients that maybe felt reluctant to go out because they felt like if they were stuck in a line, they would be exhausted or wouldn't be able to stand or walk, they now have their own built-in seat, and they can sit down and wait if they need to and enjoy museums and other areas of entertainment. They can, if they're shopping, they can use their walker sometimes to set bags on or hang bags off of, which is also a huge advantage and adds to their freedom. And in some ways, any of these devices also signal to people around you to give you a little bit of space, to offer you a seat if there's a shortage of seats somewhere. It really can help and improve your quality of life, especially when leaving the house. And next, I wanted to just touch on psychological approaches and well-being when it comes to daily life with neuropathy. For some patients, they actually benefit specifically from something known as mind-body therapy or biofeedback. And biofeedback, interestingly, has been studied in a number of conditions and shown to help improve diabetic control, muscle tension, and anxiety, among others. And it is important, if you're trying to embark upon this, to work with somebody, usually a psychologist, who is familiar with teaching biofeedback techniques. Treatments may include guided imagery sessions or relaxation techniques. And oftentimes when you're practicing this, it lowers your blood pressure, lowers your heart rate, and kind of creates an internally biologically relaxed state. And sometimes patients realize the idea with respect to neuropathy is how emotion, pain, and stress influences their body. And by learning some of these techniques to really capitalize on creating an internally, physiologically more relaxed state, this can sometimes actually have a positive effect in benefiting and reducing pain as well. It certainly goes without saying, I think that people really do not have control over whether or not they have neuropathy. And so I just wanted to say, certainly it's important to be mindful and not to judge yourself, to realize that we may not have control over what happens to us in terms of getting neuropathy, even if we do everything quote unquote right that we can possibly think of. So being mindful of our personal narrative of our illness and our experience with neuropathy can have a really significant beneficial impact. And I think it's important to really embrace and bear in mind as well. And along those lines, just to quote Coach John Wooden from UCLA basketball, he said, "Never let the things you cannot do prevent you from doing the things you can." And I think, so many times neuropathy may not necessarily be curable, but I think that when treatment responses may take many months or years, focusing on managing symptoms can be really key, like we had just discussed here, and can really lead to great improvement in daily quality of life. All right. Next, I'm going to continue on and talk a little bit about a new section, but it's really in many ways a continuation of the former section, specifically about exercise and physical activity. And certainly a response to, in responding to not only weakness with neuropathy, but also imbalance with neuropathy in terms of the optimizing daily life. This is also certainly important in and of itself. So why is exercise important? For so many different reasons. We know that actually maintaining a healthy body weight and exercise can actually help prevent neuropathy in some cases to begin with. There's something actually called metabolic syndrome, which some of you may have heard of. It is a collection of symptoms that often occur together and increase your risk of diabetes, stroke, and heart disease. And the main components include obesity, especially abdominal obesity, high blood pressure, high triglycerides, low HDL, which is the quote unquote good cholesterol, and insulin resistance, which is somewhat of a pre-diabetic state. And a person's weight is a major cause of metabolic syndrome. And it is thought that at some level, abdominal fat cells, or the fat in the stomach area, can actually raise levels in the blood of certain chemicals, which can influence other chemical and hormone balances in a way that essentially leads to diabetes or leads to pre-diabetic settings. People have actually done studies that have shown a higher risk of neuropathy in the setting of obesity, even in the absence of diabetes or pre-diabetes. So there really seems to be an interplay between fat cells and the metabolism of fat and calcium signaling and inflammation. And people think that this may be a key new insight into understanding the prevalence of neuropathy for many people. And so obviously, when we think about that, we think about nutrition, which we'll certainly be getting to, and also physical activity. Most weight loss, if you're trying to actually lose weight, may come from reducing caloric activity or intake, but even just maintaining a current weight requires a certain amount of physical activity. And there's a lot of different benchmarks out there, but just to use one from the CDC, they recommend that 150 minutes of moderate intensity aerobic exercise per week. This could mean that you walk have a 30-minute brisk walk 5 days a week, for example, is a baseline recommended amount of physical activity to maintain a healthy weight. Other benefits, though, of regular physical activity, in addition to maintaining a healthy weight, can include improved sleep, and reduced risk of diabetes, high blood pressure and stroke, arthritis, osteoporosis, and reduced incidences of depression and anxiety. So there's a lot of things there. It can be very hard to get started or to stick with it, but there's a lot of, I think, incentive that is really attractive. We've also seen that in addition to diet, that exercise can also help reduce the incidence of diabetic neuropathy, and in addition to helping to improve glycemic control for patients with diabetes. And there are certain, when we think about balance, for example, there may be certain types of exercise that have been shown to have other specific benefits, including yoga, which is not an aerobic activity for the most part, but it also there's some studies that showed a lot of health benefits is noted there. And also for some patients, they did some more formalized studies looking at 30 to 40 minutes of daily yoga for over a month in patients with diabetes, and saw an improvement in their nerve function, which is pretty remarkable. Again, that's quite a bit of yoga for most people, especially if you don't have access to it already. But the idea, I think, is really the same. The takeaway message is the same, that a regular habit of daily exercise, even if it's a half an hour, can have a really, really positive impact. Another form of exercise which has been studied a lot, especially when it comes to balance, is Tai Chi. And there have been some studies that again have looked at a regular practice, which can help improve walking, balance, strength, foot sensation, which is interesting, and diabetic control. They also looked at these nerve conduction velocities or nerve transmission in these patients. And it can also be a safe form of exercise for patients with peripheral neuropathy. Some patients are interested in exercising and they say, should I use the treadmill? And I often caution, depending on how the patient's neuropathy is, because when you're on a moving treadmill, you may not be able to feel underneath your feet. And if you trip or the speed is off relative to what you thought it was, can really be a fall risk. So I oftentimes, mention to patients, when you're looking at embarking upon exercise with neuropathy, make sure that it's something that won't put you at risk for falls or injuries. And there's a lot of things that you can do on your own, but it's just kind of thinking about things and sometimes discussing them. And frankly, for many patients, physical therapy may be really helpful and a really important part of either maintaining your current activity or balance. And for some people, it's a helpful start to help learn certain things, or strengthening exercises or balance exercises that they can continue on their own at home. I think we are pausing here and switching over for nutrition. Thank you, everyone. I'll see you again in just a little bit.
Thank you. Lisa, if you want to go ahead and turn on your camera and unmute, the virtual floor is now yours.
Hello, everyone. Thank you for inviting me to do this presentation. So to prepare for this, I looked up the nutrients that would be most connected with preventing or helping someone who has peripheral neuropathy. So we're going to talk about some essential nutrients, and then we're going to talk about some dietary patterns and some specific nutrients. Next slide, please. So let's talk about some of the essential nutrients. Well, first of all, there are vitamins and minerals that all humans need. So whether or not you have neuropathy, you want to be getting a wide variety of foods. But thiamine, B1, is one nutrient that is very involved with neuron development and neuron health. So you definitely don't want to be deficient in B1. B1 is fortified in the American food supply, so most likely, this is not going to be an issue. I have listed here the recommended daily allowance, 1.2 milligrams, and some of the common foods that you might want to include in your diet. The next one, B6. This one is not typically fortified unless you're doing something like a cereal that has like a total or something like that. Current value is listed here, and you can see some of the sources: fish, poultry, potatoes, chickpeas, bananas. Next slide, please. All right, B12 is an interesting nutrient. When somebody's stomach isn't working well because of their aging or their acid levels are reduced, you might not be able to absorb B12, so that's a factor. It's not prevalent in a vegan diet, so some vegans fortify. You don't need very much. In fact, 1/4 cup of nutritional yeast, if you happen to like that, is 1,000% of the daily value. If you happen to eat liver, beef, you eat dairy, you're probably getting your B12. Next slide. This is a little off topic perhaps, but B12 is, for some, it's considered something that can give you energy. So you see it in a lot of energy drinks. So interestingly, while it can be something that some subsets of human existence have deficiencies, there's a lot of people walking around with a very high B12. Next slide. In fact, some people drink these energy drinks on a daily basis, and you can start to overstimulate your nervous system, and you can actually get some symptoms that are very neurologically troublesome. So just wanted to mention that B12 we're in an interesting time since it is fortified in many things. All right, let's move on. Vitamin D. So I'm here in Illinois. I get my vitamin D tested every year. You probably do too. And I do need to supplement, even though I am a dairy consumer. This isn't unusual if you get your vitamin D tested and your doctor suggests that you take 800 international units is the RDA. Some people, their doctors tell them to take 2,000 units, some people 5,000 units. So this is not unheard of if you've been told to take vitamin D. And some people need to take that supplement on a daily basis. And then when they get their annual labs, they're just coming in at the low end of normal. So just something to think about. There are animal and plant sources. The D3, the plant or the animal source, is typically considered better absorbed, but lots of people are on D2 for whatever the reasons are. Next slide, please. Magnesium. Okay, so very integral with nerve function. You probably know about muscle cramps and things like that. So if you're eating seeds, nuts, legumes, whole grains, you're probably fine with magnesium. There are many kinds, so if you're going to start supplementing, you definitely want to pick a good one and talk to your doctor. Some of them are not well absorbed, so they can lead to looser stool. Some of them help with sleep, etc. So you want to be sure you're talking to your doctor if you're going to start supplementing magnesium. Okay, let's move on to some dietary recommendations. I know neuropathy, sometimes it is a result of undiagnosed or poorly controlled diabetes. So I'm one of the diabetes dietitians at my hospital. So we talk to our patients about good blood sugar control, not only eating the right amount of carbs, but also moving your body. So when those carbs go into your bloodstream, they have somewhere to go, which is your muscles, not your fat cells. If you are interested in just kind of perusing some of the cookbooks, anything that's through the MIND diet, the Mediterranean DASH intervention for neurodegenerative delay, the DASH diet, or the Mediterranean diet, those three patterns would be great cookbooks to explore as far as picking a cuisine or a food eating pattern that's going to be good for your nerves. All right, so a few more specific nutrients of concern or of focus, the omega-3 fatty acids. So you can get them in plants. The conversion's not great, but some people do the flax seeds, soybeans. They can get some of their ALA in canola oil. And some people eat fish. So if you happen to be a salmon lover or you get it every time you go to a restaurant, you're probably in good shape. EPA and DHA are the omega-3 fatty acids that are essential. I put this on here because there's different amounts based on your sex and if you're a female, the time of your life. And this has got a nice little chart about some of the common foods and how much omega-3s you're going to find. This slide I thought important because there are so many supplements. I think people find out they're deficient in something, they go to Amazon and order. And I think something like a fish oil is so critical that you're picking a supplement that has had some kind of third-party testing. So Consumer Labs is one, good manufacturing certification. So you want to be getting it from a manufacturer that is getting quality tested. A fish oil is definitely something that if you're consuming it and it's not in a safe formulation, that's not going to do you any good. In fact, you're going to be eating something that's rancid. And you know, you can do the smell test, you can look at the expiration date, but you definitely want to start with a well-sourced fish oil. Okay, let's talk a little bit about hydration. So EU hydration is just the state of being in water balance. So it's not how much water you drink, it's how much water you absorb. And that has to do with a little bit about how your kidneys and your whole digestive system is working. But basically, if you're dehydrated in general, which a lot of people are, it's possible that the medications you're taking can start to cause some neurological side effects. So we want your medicines that the doctors have prescribed to be metabolized properly and then excreted properly. So also, we don't want high vitamin levels in your bloodstream because you're in a dehydrated state. So when you work with a dietitian, we definitely can help you kind of figure out where you should be from a fluid standpoint. And it's worth mentioning for a lot of our women, we also do pelvic floor therapy because if you're going to increase your water, we don't want you going to the bathroom more. We just want you going more when you go to the bathroom. So it's more about your pelvic floor muscles. That's all part of your water prescription. All right, I believe this is my last slide. So one very important thing to remember for neuropathy would be to limit alcohol. As a cancer dietitian, the guidelines are 0 to 1 drink per day for a female, 0 to 2 drinks per day for a man. If you have neuropathy, the recommendation would be to limit your alcohol. It's not doing us any favors. There's higher incidence of neuropathy in folks who drink. All right, thank you very much.
Thank you so much, Lisa. Shauna, we'll turn it back to you to bring us home.
All right, great. Thank you. So what better way to end than to think about hope for the future? So one thing that I think is really positive when we look out there is that we think about where we are now in 2024, and sometimes it's easy to become really kind of have blinders on, if you will, in the year we're in and then last year and the last couple years. But truthfully, when we take a look at how far we've come and how much increased attention neuropathy is getting in terms of research for treatments, causes, and prevention of neuropathy, it's really, really impressive. And I think it is a cause for celebration and hope for sure. So these graphs that you're seeing are actually reflective of the number of publications in an online search engine called PubMed, which is a government-run search engine that essentially collects a lot of different academic articles, research articles, medical articles, and you can search almost like a Google field, a search term field to look up things about different topics. And some of them may be very basic science oriented, not necessarily something that would translate automatically into taking care of your neuropathy. But the top graph shows us by year how many results there are for peripheral neuropathy. And if we go back, obviously, tonight to the mid 20th century, there were hardly any. And if we take a look at the last 20 years, there are a humongous increase in articles that are being published about peripheral neuropathy. If we go down to the bottom graph, these are the search results for prevention of peripheral neuropathy. And there we can see that really over the last 40 years or so, it's gone from nothing to, again, a huge increase. This is not a plateau we are seeing. In either case, we're really seeing an ongoing increase, and I would personally expect that to continue based on what we're seeing so far. The very end of it, 2024, does look lower, but bear in mind that is because we are in the middle of 2024 when I did these searches. So that's why the very, very last bar, if you can see that closely, does look a little lower. But at any rate, so I think this is important. I think, you know, I'm not sure exactly what the future will hold, but I can tell you this, with this much attention and research and people thinking about this, we will know a lot more about neuropathy. We will know how to treat it, how to prevent it, and I think that's really good news for everyone. The other thing that I think is very interesting and also a cause for hope is that there is an increased attention, again, not just on treatment of illness, which the classic, for better or for worse, you know, a lot of the classic Western medicine focus has been on recognizing disease and treating disease. And while that's very important, I think there's a lot more people asking questions now. Hey, how can we get to a place where we're catching disease earlier and we're preventing disease and we're helping people to live even like not just a baseline, I'm not sick kind of life, but that I'm as healthy as I can be kind of life. And so actually we're seeing organizations such as the American Academy of Neurology that in the last couple of years unveiled this initiative that they're looking at, which is to create an increased awareness and to lobby for an increased awareness for what they call brain health. But in truth, they're talking about the whole nervous system. The American Academy of Neurology speaks to advocating for the whole nervous system, not just the brain, but they felt like this was a more compelling way to communicate that. And their goal is, they're really looking at their mission is to look at how they can work to help support a continuous state of attaining and maintaining the optimal neurological functioning, or the functioning of your brain, your spinal cord, your peripheral nerves, that best supports one's physical, mental, and social well-being through every stage of life. That is really a powerful statement. This is part of like their mission statement article, so it's meant to be a powerful, broad statement. But I think it's exciting because they're looking at things in terms of impacting the way that healthcare providers are trained, looking at advocacy for legislative plans or to influence, for example, what insurance carriers will cover, and shifting that more also to include preventive treatments. So I think there's a lot of, again, reasons for hope for the future, which are pretty exciting. I also think it's interesting that when we look at the last decade or two, perhaps, we are seeing a lot more emphasis on physician-patient communication, and especially when it comes to something that may be as nuanced and chronic as peripheral neuropathy. I think that's really critical because for many patients, you know, this may be a nuanced journey, a journey that is complicated. There may or may not be a clear cause for your neuropathy. The symptoms may change from season to season or year to year. And for doctors or providers who are working with you to help be open to listening to your experience and seeing the importance of what your experience is, that really dictates the care in many ways at certain times. I think that's really critical. And in the past, hopefully we're not seeing this as much, but I think the classic kind of problem paradigm that we maybe saw in the past were doctors who used to think, you know, there's nothing more I can do for you. But really the solution is maintaining a partnership over time, having that continuity of care relationship, maintaining open communication is so beneficial and so valuable. There's publications on this, articles on this. These happen to be a couple of books that were published on this that are great, really aimed for clinicians. But I think that it's excellent, and I hope that also it's a specific benefit to patients with neuropathy, especially as we move into the future. And lastly, there's a lot of increasing resources for patients. I would be remiss certainly not to specifically mention the Foundation for Peripheral Neuropathy and all of the educational work they're doing there, as well as other types of resources for patients. I have no, all of these things that I've mentioned, I have no personal sort of stake in them, but I do think there's some great books out there. This is one example. It's very It's written in a way that's very easy to understand for patients. It's not very long. It's a great resource, and there's many others out there that are like it. And so I think it's something that these are, again, all within the last, I would say, 20 years have really started to come to the forefront. And I think it's a cause for hope for continuing resources and even improving resources as we go forward into the future. So thank you so much to April and to the Foundation for Peripheral Neuropathy. It's been really a joy to be here, and hopefully some of this has been helpful. And always, I'm sincerely grateful to my greatest teachers, who are my patients, as well, for everything that they teach me.
Wonderful. Thank you so much, Shauna, I've learned a lot today. I do have to say that. Lisa, if you want to pop on screen as well, we've got a couple questions from our audience that we want to go through for the last couple minutes that we have together. So I will actually start with you, Shauna. There were some questions coming in about, given your background with COVID research, has there been any research for connection to the COVID vaccine and peripheral neuropathy from your perspective or what you've seen?
Thank you so much. So I think there are a lot of patients who certainly have different types of neuropathy symptoms, sometimes following COVID infection, sometimes following COVID vaccination. And there's a lot of, fortunately, we're not seeing quite as much as we did several years ago. But for some patients, this is a real lingering, ongoing concern. We know that many vaccines, not just the COVID vaccine, can have different types of neurological side effects, including neuropathy symptoms or other types of nerve injuries. Fortunately, they are rare. And I will say that for some patients who have neuropathy symptoms following vaccines, sometimes we do all of the neuropathy tests and they're all normal, and it can remain a puzzle. So I think we are still certainly learning more. We always, as kind of alluded to here, gather all of the data, and then regardless of what the data shows, continue to support the patients to help manage their symptoms. For some patients, the symptoms get better. Unfortunately, for some, occasionally they don't, but I think for the majority they do. And for those who may be interested, there's a group of different publications that may be more oriented toward physicians, but if you're interested, there's different publications, for example, by Dr. Rory Abrams and a number of others who have seen a number of these patients and have published some articles about that may be of interest.
Oh, that's really helpful. I think for most of our summer web series sessions, we've had questions coming in about COVID because it's the hot topic right now, but definitely speak with your doctor. And just like you said, Shauna, it can be a puzzle. Sometimes there isn't a point A to point B, and we wish it was that simple sometimes. All right, so I do have a question specifically for Lisa, and then Shauna, you're welcome to join in as well. We've talked about a lot of vitamins today. Do you have any recommendations for the L vitamins? So I'm going to butcher these names. Arginine, L-arginine, and citrulline, potentially. Any advice for the L vitamins?
I'm going to defer to the doctor. I can't say that I have that research at the tip of my fingers.
Okay.
Let me see. I'm going to look up. I actually helped write like a supplement handout, and I don't remember if those were on there specifically. There's certainly not one of the higher yield ones that I tend to recommend, but let me see if I can find that.
No worries. We can actually go to another comment that I can make. There have been a lot of questions coming in about, I get these advertisements for these specific therapies, or what can heal my peripheral neuropathy. We at the foundation always just want to caution clicking on any type of advertisements on social media, things like that. Please talk with your doctor before you undergo any form of treatment, always source your resources from the experts. And if you cannot get into your doctor quickly, you can always reach out to our organization, the info box, and that will be posted at the end of our webinar today. If you really just need a quick answer, we're happy to help you through that, but always just be aware. Additionally, I did want to mention Carla wrote in a note about her gel slippers. She says, nobody talks about gel slippers, and this is something that helps me sleep. So she wanted to make note because Shauna was speaking of making sure you're in a cool environment and being relaxed, and that is something that specifically helps Carla's experience with peripheral neuropathy. Shauna, did you find anything about the L vitamins?
So I found one on the handout that I have, which is acetyl L-carnitine, which I think was one of them. The other one did not come up, but for acetyl L-carnitine, it was shown in clinical trials to be effective, again, for diabetic neuropathy. Now, just to emphasize, as I was trying to convey, that diabetic neuropathy being the most common type of neuropathy, often when people want to design a trial to look at an intervention, they want to have some consistency in the study. And so they oftentimes will gather diabetic neuropathy patients because they're the easiest to form a group of and to study together for a response. But in studies of chronic peripheral neuropathy patients, some were treated with between 500 and 1,000 milligrams 3 times a day, again for acetyl L-carnitine, and they did show some improvement in pain and sensation in their fingers and toes. However, studies of other types of neuropathy, so not diabetic neuropathy, showed more mixed results.
Absolutely. Thank you for sharing that. I really appreciate it. Okay, so let's get to one last question here, and we'll make this one brief because we need to wrap up. But regarding specific treatments for peripheral neuropathy, there were questions coming in about red light treatments, laser treatments, electrical stimulation. Shauna, would you recommend that's kind of a case-by-case basis, or do you have any just broad advice for our folks who are getting a lot of information from Dr. Google right now?
So I think I do. So I think electrical stimulation, I will kind of pull out of at least the ones that you just mentioned, simply because in some ways, electrical stimulation and the gel slippers overlap a little bit. They change the sensory input in a way that helps make you feel more comfortable. The electrical stimulation, although some sources may say that it helps to like regrow your nerves, we do not have any scientific data that it helps to regrow nerves for patients with neuropathy. We unfortunately, sadly, do not have anything that we have really like a device that we have really strong scientific evidence that it helps to regrow nerves. I wish we did. But we think that for some types of electrical stimulation, it almost like jams up the neuropathy discomfort signals in a way. It may help people feel more comfortable. Depending on what kind of stimulation you're using, it may also help to relax muscles if there's tension in muscles from pain, and that can also be really have like a pleasant feeling and help release endorphins and help people feel better. Lasers and red lights and other things like that, we do not have scientific evidence that it is effective. One thing that's interesting to note is that sometimes in terms of devices, there is just a lot out there, and part of that is because as long as it is not dangerous, there tends to be a pretty open environment from a regulatory standpoint. And so there are a lot of things out there that are out there because they have been shown to not be dangerous, but they have not necessarily shown to be explicitly beneficial. What I counsel patients on when they ask me about those things specifically is and you will find a lot of compelling anecdotal evidence and other things that support them or a case report, but we do not have any broad scale studies that have shown that these are helpful. So when I speak to patients one-on-one, I say, one, is it going to be harmful? If it's not going to be harmful, we say, frankly, we look at the data and we say we may or may not have any real compelling evidence to show that this will be beneficial. And I usually talk to patients if they're very interested in trying something, as long as we know that it is not going to harm them, that they have a real honest understanding of what the data is. And if they want to try it for themselves, I will say I won't stop them, but I will also often make sure that people are not being financially taken advantage of, because these things are pretty much never covered by insurance. And sometimes the price tag can be very high. And so unless somebody has extra money that they don't mind spending on something because they want to try it, but it may or may not work, that's kind of the bottom line. That's my personal style. Some providers might say, absolutely not, don't try it. I usually try to partner with patients a little bit more, but make sure that they're fully informed and that they're not being taken advantage of or doing something that might be dangerous.
Of course, yeah, always a cautionary tale, right? Okay, well, unfortunately, we are out of time for this evening, but I want to give a quick shout out and thank you to our speakers today and for everyone who joined. I'm confident that the presentation and Q&A session really helped a lot of folks glean some helpful information. So thank you so much. We love to hear from our PN community, so please take the survey at the end of this webinar. This helps us understand a little bit about more content to be able to share with our community. Also, please consider making a $25 donation to the foundation if you have not yet already, so we can continue to provide programs like this and expand our mission. You can use the QR code up on the screen for a secure donation right now. If you are on your desktop, you can just use your smartphone camera. And our contact information and website are also listed for your convenience. You will receive a copy of this presentation and recording in the coming days. So on behalf of the entire team here at the Foundation, we wish you health and bright days ahead. Thank you so much for allowing us to be a part of your PN story. Have a wonderful rest of your day, and we will see you next time. Thank you, everyone. Have a good one.